Okay, Melissa. So now that we've covered your first two objectives about iron deficiency anemia, we're going to move on to the third one, okay? So we're going to talk about some ways that you can maintain your iron levels. There's three main ways that we're going to go over. Once we've gone over them, I want you to use Teach Back and tell me what you've learned so that we can make sure you've got no knowledge gaps and that you've retained it all, okay? So remember, this is not a test. It's just a way to get you thinking about some practical ways that you can keep your iron up, okay?
All right, sounds great.
Yeah, all right. So, because you're now caring for two growing babies and yourself, you need a little bit more iron than normal. So there are three ways that I want to go over keeping your iron levels up. The first way I have here is to incorporate iron-rich foods into your diet. So some examples of this could be eggs, dried fruit, muscle meats, liver, leafy greens, whole grains. So incorporating that into your diet would be really good. A second way to keep your iron levels where you need them to be is by taking prenatal vitamins. So Health Canada recommends that you find a prenatal vitamin that has between 16 and 20 milligrams of supplemental iron in it. We can take a look at some possible prenatal vitamins that you can take if you haven't started any already. Okay? So a third way to keep your iron levels where they need to be is to do some things that will maximize your iron intake. So some suggestions could be to eat your irony foods with good sources of vitamin C. For example, you could eat oatmeal in the morning, which is a source of iron, with orange juice, which is a great source of vitamin C. Another recommendation is to take your prenatal vitamins an hour before you eat a meal. If you do this, you take your prenatal vitamin when your stomach is most acidic. So by doing that and by taking your iron with vitamin C, it'll help your body absorb iron because your body will be a little bit more acidic. Okay?
All right.
Okay, so that all makes sense to you?
Yeah, that makes sense.
Okay, so can you kind of describe to me what we just learned?
Okay, so basically I just want to eat foods that have a lot of iron in them.
Yep.
Take prenatal vitamins. And give the iron an acidic environment so it absorbs better?
Yeah, that's perfect. That's awesome. So that's it for our learning here about iron deficiency. Do you have any other questions?
Not really, but how do I know when it's working?
So we're going to keep an eye on your iron levels throughout your pregnancy. We'll be able to do that through blood work. We also want you to come to us, though, if you have any questions or you notice that you're starting to experience symptoms of iron deficiency. I want you to call your doctor or call me, and then we'll be able to help you. Okay?
All right, awesome. Thank you so much, Debbie. I feel a whole lot better now that I know how to manage my health when it comes to iron deficiency.
Awesome. So no problem, Melissa. I actually have a pamphlet here. This summarizes all of the information that we went over in the PowerPoint. It's all laid out pretty simply, and it's just so that you have something to refer to if you forget anything or you want to refresh yourself. So yeah.
All right, awesome. Thanks so much.
No problem. I'll see you again soon.
Yeah, thanks, Debbie.
Shut up.